Hey everybody, welcome to today's lesson on imaging techniques in MRI. This lesson focuses on phase contrast magnetic resonance angiography, or MRA. This advanced imaging technique is crucial for visualizing blood flow and vascular structures, providing valuable information for diagnosing and treating vascular diseases. We will cover the objective of phase contrast MRA, the method to achieve it, its advantages and disadvantages, and key concepts such as velocity encoding, magnitude images, and subtraction. Phase contrast MRA is primarily used to visualize and quantify blood flow within vessels. Unlike other imaging techniques that focus on anatomical structures, phase contrast MRA provides both anatomical and functional information by measuring the velocity and direction of moving blood. We can use this information to diagnose conditions such as stenosis, aneurysms, and other vascular abnormalities. Phase contrast MRA acquisitions use gradients applied along all three axes, x, y, and z, to encode the velocity and direction of moving blood. These are called velocity encoding, or Vink gradients. These magnetic field gradients control the degree and direction of the phase shift of the magnetic moments of the hydrogen nuclei. Before the application of the Vink gradients, a sequence is conducted to collect a reference image. This reference image can be used later to create an angiogram. After the collection of the reference image, the sequence is performed applying the velocity encoding gradients. These gradients manipulate the degree and direction of the phase shift of the magnetic moments of the hydrogen nuclei within the area of interest. If the spins belong to magnetic moments in stationary tissue, they will experience no total phase shift. If the spins belong to magnetic moments in moving tissue, like blood or cerebrospinal fluid, they will experience a phase shift that is proportional to their velocity. In other words, slower-moving magnetic moments will experience a small phase shift, and faster-moving magnetic moments will experience a large phase shift. During phase contrast MRA, multiple images are acquired with different gradient settings, and these images are processed to create phase contrast images that depict blood flow velocity. The phase contrast MRA technique produces two sets of images, magnitude images and phase images. Magnitude images in phase contrast MRA represent the strength of the MR signal and provide anatomical information. These images show the structure of blood vessels and surrounding tissues, helping radiologists to correlate blood flow patterns with anatomical landmarks. We would use the reference image with magnitude images to create the angiogram. The magnitude images would be overlaid on the reference image, and subtraction would be performed to isolate the vascular structures. This process removes background signals and highlights the phase shifts caused by moving blood, resulting in clearer and more accurate flow images. Phase images display the phase shifts caused by moving blood, which are directly related to blood flow velocity. The appearance of flowing blood on a phase image depends on the Vink gradient settings, imaging conventions, and settings used during image reconstruction. Blood's brightness or darkness on a phase contrast MRA correlates with the magnitude of the phase shift, which indicates velocity. Phase images can also demonstrate the direction of flow. If blood is flowing in the same direction as the Vink gradient, it will appear white, and if blood is flowing in the opposite direction of the Vink gradient, it will appear black. These images are crucial for quantifying the direction and speed of blood flow, allowing for the assessment of hemodynamic parameters. It is important to note that the amplitude of the Vink gradient is a parameter set by the technologist before the acquisition. Remember, amplitude determines the slope of the gradient. This amplitude is based on the speed of flow in centimeters per second. Venous flow is around 15 centimeters per second, and arterial flow can exceed 200 centimeters per second. You would estimate the speed of flow based upon the area of interest, either venous or arterial, and would want to set the amplitude of the Vink gradient as close as possible to the correct speed of flow. There are many advantages and disadvantages of phase contrast MRA. Advantages include providing precise measurements of blood flow velocity and volume, allowing for accurate diagnosis of vascular pathologies like stenosis or aneurysms. Phase contrast MRA also combines anatomical and functional data in one scan, reducing the need for multiple scans. Finally, it does not require the use of contrast agents, making it safer for patients with contraindications, like renal impairment. However, phase contrast MRA does take longer to acquire data compared to other MRA techniques due to needing to collect information in all directions. The length of the scan time makes phase contrast MRA susceptible to motion artifacts, and it requires sophisticated image processing and analysis. Vink settings are also based on blood flow, which can vary from patient to patient, making it more sensitive to turbulence. In summary, phase contrast MRA provides both anatomical and functional information by measuring the velocity of moving blood. We can use this information to diagnose conditions such as stenosis, aneurysms, and other vascular abnormalities. Phase contrast MRA acquisitions use velocity encoding, or Vink gradients, applied along all three axes, x, y, and z, to encode the velocity of moving blood. Phase contrast MRA produces two types of images: magnitude images, which provide anatomical information, and phase images, which provide information about the velocity and direction of flow.